Hello everyone, my name is Sayed Amir Muhammad Tarawati and I'm pleased to present my analysis of the global response to 2014 Ebola outbreak in West Africa through a One Health lens. Today I will critically assess the international response to this outbreak with particular emphasis on how the actions aligned or failed to align with international health regulations or IHR and One Health principles. I will also explore key gaps in coordination and integration, especially concerning human, animal, and environmental health, and offer recommendations to improve future responses. The 2014-2016 Ebola virus outbreak in West Africa was an unprecedented global health emergency, with over 28,600 confirmed, probable, and suspected cases and more than 11,300 deaths. It was the largest Ebola outbreak ever recorded. The crisis overwhelmed already fragile health systems, especially in Guinea, Sierra Leone, and Liberia, and sparked widespread social, economic, and political disruption. It also exposed critical weaknesses in global surveillance, coordination, and response mechanisms. This presentation critiques the global response from One Health perspective, acknowledging the interconnectedness of human, animal, and environmental health in managing infectious diseases threats. The outbreak began in December 2013 in a rural village in Guinea, likely originating from a zoonotic spillover involving food paths. By mid-2014, it had spread to densely populated urban centers and across the borders to Liberia and Sierra Leone. The virus's rapid transmission was facilitated by poor health infrastructures, lack of early warning systems, and inadequate public health communications. Cultural practices such as traditional burials also contributed to high transmission rates. Despite early alerts from NGOs, global mobilization was delayed. This slide contextualizes the outbreak scale and complexity, setting the stage for our critique to the response. The aim of this presentation is to conduct a structured critique of the global response to Ebola outbreak of 2014 using international health regulations and One Health framework as an evaluation tools. The objectives are to identify key strengths and successes, expose critical gaps in preparedness and implementation, and offer evidence-based cross-sectoral recommendations. This approach not only appraises what was done correctly, but seeks to understand what could have done better to prevent such widespread impact, particularly considering the zoonotic origins and ecological dimensions of Ebola. This presentation employed the After-Action Review or AAR model structured around four key questions comprising of what was expected to happen, what actually occurred, why were there discrepancies, and how can future outcomes be improved. To complement these elements of the Joint External Evaluation JEE tool were integrated to assess national and global capacities in IHR compliance. The other sources included peer-reviewed journals, WHO technical reports, and policy documents on One Health integration. The methodological triangulation ensured a well-rounded, evidence-based critique accounting for both technical, public health capacities and multi-sectoral coordination challenges. The global response involved a wide range of actors including WHO, Doctors Without Borders, the U.S. Centers for Disease Control and Prevention, or CDC, and the United Nations Mission for Ebola Emergency Response. Despite these efforts, a coordinated global response did not begin until months after outbreak's exponential growth. The WHO's declaration of public health emergency of international concern was not made until August 2014. By the time community transmission was widespread, while significant resources were eventually mobilized, including treatment centers, rapid diagnostic tests, and vaccine trials, early fragmentation, delayed leadership, and weak interagency communications hindered effectiveness. Eventually, several successes emerged despite the initial delays. Notably, the RVSV Z Ebola vaccine developed during the outbreak showed over 95% efficiency and was a critical part of outbreak control. Rapid deployment of mobile labs, improved case confirmation, community engagement strategies such as contact tracing and safe burial practices help control the transmission. Partnership with local leaders enhance acceptance of health interventions. In later phases, international funding and technical expertise strengthened the response infrastructures, and these successes highlight what is possible when global solidarity, innovation, and public cooperation align under emergency conditions. On the other hand, the response was impaired by major weaknesses. WHO's slow action drew heavy criticism and highlighted structural inefficiencies. Many actors worked in silos with overlapping or conflicting mandates, leading to duplication and resource misallocation. Crucially, the response lacked integration with veterinary and environmental health sectors, despite Ebola's zoonotic nature. Surveillance systems did not incorporate animal health data and ecological drivers of the outbreak, including deforestation and wildlife contact that were largely ignored. These gaps underscored the risk of purely human-centric response model in management of complex zoonotic infectious diseases outbreaks that does not comply with One Health principles. A One Health analysis reveals missed opportunities for early containment through cross-sector collaboration. There was no coordinated surveillance of wildlife reservoirs or livestock, even though spillover risk was well established. Veterinary capacities in affected countries was minimal and not included in planning or implementation. Environmental degradation, which had facilitated bat-to-human transmission, was not overlooked in the risk assessment. This fragmented approach led to delayed detection and ineffective prevention strategies. The Ebola outbreak exemplifies why a unified One Health framework is essential for epidemic preparedness, especially in regions with frequent human-animal environment interactions. The International Health Regulations, or IHR, aim to ensure global health security by requiring countries to develop and maintain core public health capacities. During the Ebola outbreak, most affected countries fell short, especially surveillance, laboratory testing, and risk communication. WHO also failed to meet its leadership responsibilities under the IHR, contributing to delays in mobilization. Even after the declaration of the public health emergency, gap in governance, funding, and logistical coordination persistent. These compliance issues illustrate systematic vulnerabilities that still exist in many low-income nations and the need for stronger accountability mechanisms at the global level, especially during the outbreaks. Key lessons learned from the outbreak include the critical importance of early detection systems that incorporate data from human, animal, and environmental sources. In addition, public trust and culturally sensitive communication strategies were considered crucial for improving adherence to public health measures. The outbreak also revealed the limitation of international response mechanisms and the need for pre-established emergency funding and task forces. Future successes depends on fostering regional partnership, investing in workforce training, and embedding One Health into national health planning to address complex, interconnected issues of zoonotic diseases outbreaks. Going forward, I recommend full integration of One Health approaches into national and international outbreak preparedness plans. Countries should build cross-sectoral networks ensuring veterinary, environmental, and public health services collaborate routinely, not just during the emergencies. WHO should prioritize One Health capacity building and expand its joint external evaluation scope to assess non-human sectors as well. Donors, NGOs, and governments must fund multi-sectoral surveillance infrastructures, particularly in high-risk areas. These steps will ensure that zoonotic outbreaks like Ebola are detected and contained early, saving many lives and much of the required resources. In conclusion, the 2014 to 2016 Ebola outbreak exposed serious flaws in the international health response, but also offered valuable lessons. The lack of coordinated One Health approach delayed containment and increased the toll of the epidemic. Strengthening IHR compliance, building national capacities, and embedding One Health into DNA of public health system will be crucial for managing future outbreaks and epidemics. An integrated, proactive, and globally supported system is not just ideal, it's essential for global health security. I hope that you find this presentation informative, and I thank you all for your attention and time. I will now just quickly go through my references that I use for this presentation. This slide mostly contains the journal articles reviewed in this presentation. This slide and the next one mostly contains the WHO frameworks for One Health and IHR principles that were used in this presentation. Thank you for your attention.